Welcome to Counterpoint. I'm Tanya Granick-Allen. Many of us have heard that, especially since COVID, the mental health of Canadians has been on the decline. At the same token, however, we are seeing more investments and more attention being paid to programs and ways to help Canadians cope. In 2021, the governing Liberals made an election campaign promise to launch a Canada mental health transfer that would have sent a total of $4.5 billion to provinces and territories over 5 years. Earlier this year, the government announced $25 billion in new spending on the Canada Health Transfer. It is hoped that much of this money would go to mental health. However, some critics are decrying that the portion that would actually go to mental health is merely a drop in the bucket. Recall that healthcare implementation, including mental health care, falls under provincial jurisdiction, and the federal government merely provides the healthcare dollars. So, are these new funds adequate? What should provinces be focused on as they disperse this new spending? How can we do better for all our mental health? Joining me later in the program will be Dr. Taslim Alani-Verjee, a clinical psychologist with the CILM Centre for Mental Health. But now I'd like to welcome Margaret Eaton, CEO of the Canadian Mental Health Association. Margaret, thank you so much for joining me today for this important discussion.
Thank you.
So let's, maybe if you could just walk us through, what is the state of mental health for Canadians today?
Well, we really saw mental health decline during the pandemic, as you said, and over 50% of Canadians said that their mental health had been affected by COVID. And we saw the numbers actually get better once the largest threat of COVID had disappeared and people were kind of getting back to normal. But the general feeling of well-being has never matched the pre-COVID period. And now what we see is the social determinants of health and mental health really taking a toll on people's mental health. So things like the possibility of entering into a recession, the high cost of living, including the cost of groceries being so high, housing being so unaffordable for many people, and fears about the environment are something that really lowers the mental health of young people in particular. So there are a lot of pressures on all of us right now. And unfortunately, we don't live in a country that has universal mental health care. So there aren't a lot of supports to help us when things get tough.
So let's talk about that for a moment, because I do find that so distressing. There's almost like a patchwork system when we're discussing mental health care. To me, and probably to many of our viewers, mental health care is health care. So why, if we have universal health care, do we not have universal mental health care?
Yeah, it is distressing, and other countries have it. So if you were in New Zealand or Australia, the United Kingdom, the European Union, there'd be many more resources for mental health. But in Canada, when they created that Canada Mental Health Transfer in the Canada Health Act, they didn't include services for mental health beyond things like emergency rooms and psychiatrists. But we know that many mental health conditions are things that should be treated by community mental health care. So things like psychologists, psychotherapists, peer support programs, and things like substance use programs are not at all funded by through that Canada Health Act. So it really is over to the provinces then to try to allocate some of their funding to address some of these issues. But it means that care is really, as you say, a patchwork quilt. And the kind of care available to you in St. John's, Newfoundland might be very different from what's available in Whitehorse or downtown Toronto. So it really depends on, do you have an employment program that actually provides you some support for mental health? Can you afford psychotherapy, which can be sometimes $200 an hour? And then even if you could afford it, can you get access to it? Are there the healthcare providers out there that could actually give you the support you need? So we're very concerned that Canadians are suffering and there isn't much help for them.
Now, when we talked about the impacts of the pandemic, we only have about 40 seconds left. What were some of the acute impacts you saw with adults?
Yeah, with adults, we saw instances of anxiety and depression peaking, especially for women and women with children who are particularly squeezed. Seniors, especially dealing with loneliness and isolation, were also very hard hit. And we saw the instances of substance use going up, and suicidal ideation went from 1 or 2 percentage points of Canadians experiencing suicidal ideation. It peaked at about 10%.